Support for the statewide broadcast of the State of Ohio comes from Medical Mutual, providing more than 1.4 million Ohioans peace of mind with a selection of health insurance plans. Online at medmutual.com/Ohio. By the law offices of Porter, Wright, Morris & Arthur, LLP. When dealing with legal issues facing Cleveland businesses and individuals, the first step in communicating is listening. Porter Wright, making sense of it all. More at porterwright.com. In the Ohio Education Association, representing 120,000 members who work to inspire their students to think creatively and experience the joy of learning. Online at ohea.org.
As we have reported several times, Ohio leads the nation in opiate overdose deaths. More than 8 people died each day on average in Ohio last year. Thousands more people are addicted to opioids, from prescription painkillers to heroin. And in many of these cases, the addict has a family. In the last 7 years, the number of children taken into custody by children's services agencies soared by nearly 20%, from just under 12,000 kids in 2009 to nearly 14,000 kids in 2015. Parental drug use was involved in half of children taken into custody by children's services last year. 28% of those kids had parents using opiates, and 7 in 10 of the infants under a year old in custody also had parents using opiates. Kids are staying longer in foster care, and more kids are being placed in permanent custody or being adopted than being returned to their parents because of parental drug addiction. And that's driving foster care costs up by 2 and even 3 times in some counties, and it's creating shortages of foster homes. But at the same time, state funding for children's services has plummeted by $93 million, 17%. And the Public Children's Services Association of Ohio says that puts the state at dead last in the nation for state general revenue funds invested in children's services. All this is putting tremendous weight on the county children's services agencies and those who are trying to care for these kids in this crisis. This week, I talked to 2 people on the front lines of this battle. Dr. Lorra Fuller is with Scioto County Children's Services, a county at the center of Ohio's opiate epidemic. Robin Reese is with Lucas County Children's Services, who notes that urban counties have been dealing with some of these issues for many years. So in an op-ed published this week, David Haverfield, who's the director of Tuscarawas County Job and Family Services, wrote, "The system tasked with caring for the youngest and often invisible victims of this opiate crisis is breaking under the pressure." I want to ask you both, since you're working in those county agencies, what does that actually look like? And I'll start with you, Lorra.
Well, I can tell you that in Scioto County, we have seen a tremendous increase in the babies that are born drug exposed. Just from 2015 to 2016, we took in twice as many babies that were born drug exposed. That means that these babies are staying in care longer, have greater needs, and it's difficult to find placement for these babies. We rely on relatives a lot, which is kinship placements, but we also rely on our foster parents.
And let me ask you, Robin, in the Toledo area, what does that look like where you are?
Well, in Lucas County, believe it or not, we have through the Sheriff's Department, we have a program called DART. They looked at all of the zip codes, and we had zip codes in Lucas County where they had over 400 overdoses. We compared our population to that population, it matched. And so we saw a tremendous increase of kids coming into care. You know, probably 5-6 years ago, we didn't even recruit that much because we didn't have high numbers of kids in care. And all of a sudden we saw the numbers creeping, not sure what they were. And we got an indication from our drug court because all of a sudden, you know, we were dealing with families that were dealing with the crack addiction. All of a sudden, 99.9% of the families were dealing with heroin and opiate. And so then we saw our numbers start to increase. We looked at it last year. 59% of the cases that we dealt with had drugs as an issue. When we looked closer at what was the primary problem, it jumped to 79%. And so we just saw this tremendous increase. Then we began to see babies coming in, coming from hospitals that were being released on methadone. Mm-hmm. And our caregivers, we saw them starting to suffer. And our response immediately was, we got to get more foster homes. So we started a recruitment campaign to recruit 400 foster homes because just last year we had 510 new cases to come in. And at a time when we only have 250 foster homes. And so that was part of our response. Let's get out, let's get some more foster homes. And believe me, it is heartbreaking to talk to a foster parent that has been up 36 straight hours with a baby coming from the hospital on methadone. And one of the reasons why it becomes so critical that we get more caregivers is because they're already overwhelmed, foster parents, because we have a lot of kids in care. And I mean, I can't even imagine having 2 or 3 kids in the home and then having to be up 36 straight hours, and that's what we're dealing with. And we're also, just like in her county, we're literally holding the hands of families, trying to walk them through drug treatment. And I have been in this business for 33 years, and I have never seen any addiction, and we've gone through many of them, where parents lose, they just lose not the ability, but the will to want to get their kids back. Right. They're driven by trying to get the drug. And so when you get a case involving opiates and heroin, the kids are staying in care.
So I want to pick up on what you were saying and what Lorra was saying, both about the newborns that are born addicted. But there's also this other element too of not just the healthcare costs for those newborns and all that it takes to get those newborns off the drugs that they're on, but then there's also the trauma that older kids might see. I mean, David Haberfield's op-ed talks about a little girl who was 8 years old whose father OD'd. Her mother had never been in her life, and now she's traumatized by this whole life that she's been living through. Let me ask you about that. The costs of this have to be immense long term.
They are. And what we're seeing is we've seen a tremendous impact. You know, we only have about a $2.5 million budget, so we're considered a medium-sized county. We do have a local levy, thank goodness, but just since 2015, we've seen a $400,000 increase in boarding costs. So these kids are staying longer. I mean, we're talking about, you know, going from 4 years ago having an average of 100 kids in custody to having an average of 170 kids in custody. So no increased funding other than, you know, our local levy. Thankfully, we were able to pass another levy in 2015, but still yet that is not going to cover our boarding cost.
And this idea of these long-term costs on not only the newborns that you referenced, but the older kids. I mean, there's physical costs for care as well as mental health costs to try to help these children recover from what they've seen and what they've witnessed.
Absolutely, it is. You know, just speaking about the question that you asked her, we recently had a case, and when the kids were removed, the child, I think she was about 10 or 11, she knew how to administer the Narcan to her parents. They had trained her to do that. And the father had to get 3 or 4 doses because of the level of drug use that he had. So, I mean, we're seeing kids come in with, I mean, they're just traumatized. And we're seeing more kids that are parentified. They're caring for their sisters and brothers. And, you know, not having enough resources and caregivers, you don't want to have to split those kids up, but they're coming in so fast. By the time we get folks through the certification process, I mean, the ink is barely dry before we're calling them, and they don't know how to deal with this kind of trauma, and so it's just, I mean, it's really a bad situation. It's truly an epidemic. I don't want to understate it. It is an epidemic. And
you referenced this, Lorra, too, this whole idea of kids staying longer in the system. You're now having situations where more kids are being permanently retained in custody or being adopted out than being reunified with their parents, which has got to be, there's so many ripple effects to that, I would think.
Right, and there is, and you know, what we have seen is a tremendous increase in those numbers of permanent custody kids, just for us in the medium-sized county that we are, you know, going from having 10 kids a couple years ago to having 22 kids in permanent custody. We finalized 8 adoptions in 2016. That's unheard of in our county. But we have foster parents that are coming in, you know, they're coming in as foster to adopt, and you know, they're able to adopt within a year or 2 years, whereas before when families would come in and want to adopt, it would take them much longer. But these foster parents are taking these babies straight out of the hospital, or taking these kids, you know, in when, you know, their parents, we might go to a drug bust, or we might show up at the grocery store parking lot where mom has OD'd, you know, and my staff is going there as essentially first responders and dealing with that child that's in the back seat. You know, so these families are traumatized, and these kids remember. You know, when you're dealing with an infant, they don't remember their parent, but when you're dealing with, you know, 6, 7, 8-year-olds, they know, and they want to be with that mom or with that dad. And when they can't maintain sobriety and they can't get them, they become angry. They are angry children. And so then you're dealing with that, and you're dealing with, okay, well, maybe now you're looking at, it can't just be a traditional foster home. Maybe you're looking at therapeutic, or heaven forbid, it might be residential treatment, because then your costs skyrocket.
And these kids are kids who have already been taken taken out of their home environment. They've lost whatever possessions they might have. They've been taken out of their schools sometimes.
Right.
And so there's a lot of readjusting to do. Robin, you hinted at this too, this idea that there was the crack cocaine situation that urban areas were dealing with. I mean, we've heard a lot about what rural counties are dealing with the opioid crisis, but a lot of urban counties have been dealing with some of these problems for years.
Absolutely, we have. But for some reason, this one looks so different. And we're trying to wrap our brain around why it's so different. But right now, we have about 450 kids in foster care. We are fast approaching spending $1 million a month just on placement cost. That's the impact. And you know, it's funny because we had a levy also, and I had to go before various community agencies, and they're like, we want you to solve this problem. This is not sustainable. And I'm like, really? I mean, it's not, but this is what we're seeing coming the door. Now, the thing for me is that child protection, we've pretty much been a reactive agencies. When they come to our door, we respond. We're trying to change that. We have to push prevention, and that's what I'm trying to get more involved in, how we can prevent folks from getting on drugs.
I want to ask you about the impact on not just the families now, but shifting to the workers that are employed by your agencies here. Like you mentioned, Lorra, they're first responders. Right. Some of these people are fairly new on the job. Some of these people are very low paid, and the turnover must be tremendous, and the things that these people are seeing.
Right, and it is. We have gone through, in our investigative department, which is your first responders, they're getting the call, they're going out and knocking on the door. We've gone through 8 people in 1 year. You know, they get there, they decide this isn't for them. Unless you work in child welfare, you have no idea what child welfare is going to be, especially as an investigator in that department. And we just had a case, unfortunately, this week where we had a dad who was wanting drugs. He held his wife and his son essentially and beat them and beat the child until, you know, she was willing to go and get him drugs. So my staff, who has been there 4 months, had to go there, and he said, you know, the baby was still bleeding when I got there. You know, that's his response. You know, that is trauma. That is trauma. That happened over the weekend. He's still traumatized by it today, and probably will be throughout his career, because that's just something that you don't see and you don't want to see when somebody is willing to hurt their own 2-year-old in order to get the drug that they're wanting.
Let me ask you both, transitioning to how to deal with this. I mean, you've seen a dramatic loss, in a sense, of the funding. As your caseloads have gone up, the funding has gone down. Robin, you hinted at this too, that having to go and talk about the levies. Not all counties have levies that support children's services. So how has it been that the funding has dropped when we've been talking about this opioid crisis for I don't know how long?
Well, because children are the silent victim, and people focus in on making the adults healthy, and they don't really look at the child part. Mm-hmm. And so that is part of what we're trying to do, is to have a seat at the table to say these are the silent victims in this epidemic. And it's hard. I mean, it really is. It's hard to get that seat. But it helps when you're able to tell the truth about what is going on. And you talked about trauma. Just before the holidays, first of all, you get, with extensions, families get about 22 months to get your kids back. And that's with extensions if you're really diligently working on your case plan. In this addiction, there's constant relapse. And so we had a couple of cases that we were working on. The families had kind of, you know, they had gone through treatment and everything. And honestly, we were working on a reunification, and one of the families, the mother overdosed and died. And her kids were having extended visits with her. We were working them back home. And I can't even explain to you how traumatized the staff were to have to deliver that message to the kids when they thought they were going to be home for the holidays. And so that is the kind of trauma that staff is experiencing.
We keep getting a warning that this is going to be a very tough budget process. You'll be competing against other interests such as education, prisons, infant mortality, tax reform, other things like this. What do you want to tell state lawmakers about what you're dealing with as you're trying to compete against all these other issues that they're being asked to fund?
You know, for us, unless they do something, it's only going to continue to get worse. I mean, these children are going to be the future of Ohio. I mean, these children are being traumatized, and if we are not there to be able to provide the care that they need, and care in general, encompassing everything, mental health needs, you know, just their social needs in general, if we're not there and we're not able to do that, what is going to be the future of Ohio? I mean, these are the kids that we're talking about, you know, that's going to be in the workforce, hopefully in the workforce one day. But we have to be able to get them stabilized. We have to be able to reduce that trauma. We have to be able to effectively deal with the whole person.
Even before you get to the point that Robin was making about prevention and trying to stop this problem,
Right.
You're dealing with the whole end of the impact of it.
Right.
Let me ask you, Robin, what do you tell state lawmakers who are saying, we've got all these groups that are coming at us saying we need funding?
Yeah, you better invest in your children. That's the bottom line, because in child protection, unfortunately, we see what happens when you don't invest,
Right.
because those same families come back, and they were children, you know, and now they have children, and we're dealing with those situations, and so it's worth the investment. And I mean, I can't say that strong enough. No, kids don't vote, but eventually they will. And I mean, we have to invest.
But money alone won't solve this problem, right?
No.
What will?
I don't know, and I agree with prevention. I agree with that. I think that we have to get in there and we have to start earlier. I mean, I'm talking in preschool. You've got to be talking to these kids about, you know, you don't, because now they're already going to be genetically predisposed. They've already been in this environment where they see that addiction is acceptable. But you have to get in there and you have to teach them early. Don't ever pick up that drink or that drug. That's really the only issue. And talking about that violence is not okay. These kids live in homes with violence, whether it's, you know, domestic violence, you know, physical abuse on them, other types of violence. You have to get in there and you have to teach them that this way of life that you've been experiencing is not okay. That there are people out there that's going to love you and take care of you regardless of the way that you behave or the way, you know, that you respond, that it's going to be okay. And I think that we have to start early. And I agree. You know, I always say that we're a reactive agency, and that's unfortunate. I mean, there's 19 people, including myself, at my agency that deals with, we served over 2,000 kids last year.
You're at the epicenter of the opiate crisis.
We are, yes, yes. And we're seeing, you know, more and more kids. When half of your kids are under the age of 2, you know, in custody, there's something significantly wrong. I mean, our system is broken and it has to be fixed.
Support for the statewide broadcast of the State of Ohio comes from Medical Mutual, providing more than 1.4 million Ohioans peace of mind with a selection of health insurance plans. Online at medmutual.com/Ohio. By the law offices of Porter, Wright, Morris & Arthur, LLP. When dealing with legal issues facing Cleveland businesses and individuals, the first step in communicating is listening. Porter Wright, making sense of it all. More at porterwright.com. In the Ohio Education Association, representing 120,000 members who work to inspire their students to think creatively and experience the joy of learning. Online at ohea.org.